My name is Nicolette Rosendahl, and I'm an internal medicine physician and osteopathic neuromusculoskeletal medicine physician here at the Corvallis Clinic. So I'm a native Oregonian. I grew up in Coos Bay, Oregon, and my interest in medicine actually came from my dad, who's a veterinarian. I just wanted to work with people instead of animals. I went to the medical school in Lebanon, Oregon. I was in the first class there, and then completed my residency in Iowa in internal medicine. And I picked internal medicine specifically because I like the complex medical care that you can get for a wide range of patients. There wasn't one specialty that really caught my interest. I liked every part of medicine, so that's why I chose to stick with internal medicine. And then my interest in osteopathic medicine came during medical school. I was able to do extra training, hands-on training and teaching, which really drove my passion to helping people as a whole body practitioner and working with mind, body, and medicine all together. So it really makes a complete physician, complete package. I went to college at Oregon State, so I moved here and spent a lot of time in the area. So I really grew to love the population and loving all the interests that Corvallis can provide. It's a very cultured community and a very healthy community, so I've always wanted to come back and explore that more and to help people that are here. I think a lot of my patients describe me as someone who listens. I really like to take the time and focus on what they're saying and really take in all of the information they're giving me to help them become a better person. Whether or not I can fix that, it's not always the case, but at least having a better understanding and taking the time to listen and being caring is really important to me, and I think my patients can have that. Patients have described me as being kind-hearted and patient with them. They've also appreciated how I listen and try to understand their story and where they're coming from. So I love to be outdoors. If I could have my practice outdoors, I would. So right now I'm really into hiking because it's the summertime. So being outside, going on those 4 to 10 mile hikes and really pushing myself to be stronger both mentally and physically is important to me. I also like cooking, so when I'm home I will try a new recipe a couple times a week. Again, trying to be healthy, but sometimes I cheat. I love making desserts and breads, so those are the big things I like to do. I would like people to know that I appreciate starting where they are with what they have. In medicine, you can't always have perfection. And I think guiding people through understanding their health can be very rewarding, especially to the patient, but also to myself as I'm learning from every patient every day. I appreciate the good days and the bad days in medicine because every day I'm learning something from every patient. I can think of patients I've helped kind of understand their health and understand when we're treating, especially with osteopathic medicine, I might bring up something that they weren't realizing was causing the problem, and helping those patients through that process and realizing more about their health and how they can help themselves. So that's been really rewarding. And the patients themselves come back and they say, this has been a great experience for me and I wouldn't have had that otherwise.